You can thank Sheetal for all the tendon and ligament questions. All right, so that's kind of the overview of the rotator cuffs. Now let's go to the specifics. And I think you should have an easy time learning the basics about the rotator cuffs because they're all named for the areas in the scapula that they live. And I think most of you are pretty familiar with this already. And it's pretty straightforward too, you know, what actions they have based on that. So let's take a look. Remember, we're starting with the O in red. I don't actually want to stop spotlight. So supraspinatus, supra for the prefix like superior. It originates in the supraspinous fossa of the scapula. Remember, I love this feature in Trail Guide where it actually shows you like how much attachment. So we're talking about like area I'm sitting in right now, like the entire supraspinous fossa. And, you know, you've all been palpating, right? The spine of the scapula, you know, what muscle superficial here? What muscle superficial to superficial? I heard some people say it, trapezius, yeah? So on top of it, yeah. So when we warm up through there, we can get into this supraspinous fossa. What does superficial mean? Closer to the skin. Yeah, superficial. Awesome. All right, cool. So, and then the insertion in the greater tubercle of the humerus. So out here on the lateral big bump on the humerus. So this big bump out here. And again, the full-size models are really great to palpate for this. And then pretty cool about the belly of the supraspinatus. Now going to the top drawing for this. It's pretty awesome, very clever. I don't know if you've noticed this before, but where the acromion process of the scapula meets the clavicle, there's actually a tunnel under there. So pretty wild. The supraspinatus muscle goes under that tunnel to attach on the greater tubercle. So you can't really see that right in the two-dimensional drawing, but they're indicating it right by showing you the muscle belly on either side. So I would say this is a nice, thick, big, strong muscle. But notice that its fibers cross straight over the glenohumeral joint, the shoulder joint, not in front of and not behind of, just straight over. So if it goes straight over and we shorten that distance, let's say from like 4 inches to 2 inches, what movement will we have on this glenohumeral joint? Abduction. Awesome. Awesome, awesome. Abduction. Perfect. And then what do all the rotator cuffs do? Stabilize. Yep. Awesome. So that's all we got on the supraspinatus. Do you have any questions about it? Awesome. Pretty straightforward.
One of my favorite muscles.
Is it? Why? I want to hear.
It just sits in there like a little loaf. I just think it's so cute. And also the name is nice.
It makes you sound super like with it, right?
Yeah.
That's such a cute reason to like that muscle. I like this muscle too, but I never thought of it like a loaf.
No, I haven't either, but I do like this one too.
Like a tiny cornbread.
Oh, I was thinking of cornbread once you said loaf, which got me to thinking about my bees and getting some fresh cornbread and butter and honey.
So it's like the cozy, like, what is that? Heidi?
Huga.
So it's like the Huga cozy muscle.
All right, so infraspinatus, infra like inferior, and spinous like spine of the scapula. So obviously we have this nestled in the entire infraspinous fossa. That's our origin, infraspinous fossa of the scapula. And again, the cool thing about these trail guide drawings that show you the shading is it shows you exactly how much of the bone it attaches to. I like to visualize that. And, you know, you might already be thinking about this, but these deeper muscles, when they are deep, the deepest muscle in that area, they have a bigger part of the bone to attach to, right? If they're more superficial, they gotta kind of go around the stuff that's taking up more room or on the little ledges and so forth. So we have a big origin here. The infraspinatus inserts on the greater tubercle of the humerus. And this one we can see in a posterior drawing. We're going around the posterior aspect to attach. Highlighted the last one, infraspot, but there's the infraspot in the greater tubercle. So you can see from those two diagrams that infraspinatus and supraspinatus, they both attach to the greater tubercle, but they don't attach on the exact same spot. So they're like side by side, but those tendinous attachments, the connective tissue really gets connected, right? So just like we were talking about that awesome triangle on top of the shoulder girdle of the spinous scapula and the clavicle, and how traps come down to it, deltoid comes down from it. Whenever they're sharing a spot, you always want to talk to both of them, right? Because their connective tissue is intimately connected, right? So we would talk to them both together. And let's think about this one now. So now we're talking about a muscle that is coming in the posterior triangle of the scapula, this whole infraspinous area, and it's attaching from the back. So we're crossing posteriorly. Now, what movements do we think, if we shorten the area from here to here, what movements do you think we can do? Awesome. So we can now pull it backwards, right? Awesome. What else do you think you can do? Adduct. Awesome. You can bring it down. Awesome. Yeah, you're correct in saying adduct, but it's just hard to hear sometimes. Yeah, perfect. And then what's the one all the rotator cuffs do? Stabilize. Awesome. You got it. You got it. Questions on this one?
Does the infraspinatus have 3 parts to it? I'm looking at the illustration. It looks like there's like 2 outside and 1 inside.
Yeah, great question. You know, the way that I've heard this described and like the way that I've like felt it is that it's like lots of layers of this muscle. And so you'll feel that like when you're in the infraspinous fossa and on the infraspinatus, whether like we'll use the soft fist or the forearm or whatever, that it can feel really like thick and bumpy and lumpy. It's just got a lot of fibers, kind of thickness and converging is how I would describe it, more than like 3 separate muscles.
It kind of looks like skirt state.
Yeah.
Yeah, exactly.
I'm sorry if there's any vegans here for more reason than just this conversation. We're thinking of what? Brain and juice. Oh yeah, the little segments. Yeah, totally. All right, so now we're doing teres minor. So we always start with origin. The convention is to do this in red. So a lot of you have models with red and the blue on them. That's showing you the origins and insertions. That's the convention. So our teres minor originates on the upper 2/3 of the lateral border of the scapula. Now, I am 100% not saying that Trail Guide is wrong because they know their fit. But I will tell you that as a massage therapist, and some of you started to palpate this already, right? This teres minor, what it feels like on the human body is that it's like way up high and thin, but very strong. So like as thin as like my thumb or my finger, but it's a strong one. And I'm just calling that out because upper 2/3 makes it sound like a big ass muscle, but it's really, it's a skinny, but very strong, tight on everybody. I've literally never touched someone with teres minor that's not tight. Have you two? Never?
Until we did thin and stretch. And then.
Oh, you found someone with, afterwards. Oh, okay. Yeah, afterwards. Yeah. And I've kind of called this out before, but like when you're palpating it, it feels like it's like almost in the armpit. It's like, it's way up high. All right, and it inserts on the greater tubercle of the humerus. So we're sharing that greater tubercle, this wonderful bump with 3 muscles, and that is an interesting and incorrect abbreviation they have right there. It's weird that they have caps. Usually you use a lowercase for teres minor. Anyway, you can see that it attaches posteriorly. And so we have this little muscle attaching posteriorly. Now, let's think about this. I'm going to draw infraspinatus in pink, and the infraspinatus and the teres minor muscles. What would you describe about like angle of the fibers and how they angle and attach and what angle they cross the joint? Similar? Yeah, they're almost the same, right? So if they're crossing that joint almost the same exact angle, what can you deduce, infer, guess? Complete synergist. Awesome. So what does it mean to be a complete synergist? All the same actions, right? You can say something is a synergist, it might just have one of the same actions. But if you say it's a complete synergist, they have all the same actions. And again, this is super helpful if you look at the shape of the muscles and how they cross and you start thinking like that, instead of think you're like studying like 100 separate muscles, right? And then you're like, oh my God, it's way too much to memorize. But right now you're just looking at these two and they're like, oh, they're like kind of almost the same muscle and they do the same thing. So we've already figured out that that would be laterally rotating the shoulder, right? Because we're pulling it from behind. It can adduct the shoulder because we're coming across, so we can bring it down and then they all stabilize, right? So questions on teres minor?
Just a quick one with
Yep.
the infraspinatus.
Mm-hmm.
Does it kind of like sit on top, or are they very much side by side?
Yeah, great question. I mean, I think there's a little bit where they cross, but they're also kind of more side by side. Yeah, great question.
I have a general question about joints in general.
I'm sorry, I'm going to go back to that one more time. When you look at diagrams, it looks like it crosses a little bit, but when you feel it, yeah, it feels like they cross. Yeah, sorry, go ahead.
No problem. Do all ligaments have bursa?
Great question. No, there's not a bursa in every spot. Yeah.
The infra and the teres major.
Minor?
You said they cross. So would the teres minor be under the infra?
Yeah. Yep. And they're mostly side by side, but minor goes a little bit under major. Infra.
To the bone itself.
Yes, they attach to side by side, but it's just that infra comes from a bigger area.
The attachment of the infra is more on the medial, correct?
Well, and on the entire,
Or are they kind of?
are you speaking about the humerus side?
I'm talking about the fossa, is it?
The fossa is more medial, and the infra takes up a huge part of the attachment, whereas teres minor is way out on the lateral border. Yeah, and in fact, when you're palpating it, and we are going to have a palpation lab today, and if you haven't already noticed, Trail Guide has this awesome section where they walk you through exactly how to palpate everything. But anyway, the best way to find minor, teres minor, is to walk up the lateral border, and it's just way up high. And then when you feel it's, very ropey, you can't miss it. Yeah. Whereas infra, you can feel in this whole big triangle, and you're just on infra. Yeah. All right. So then our last rotator cuff is perhaps the most confusing, but I mean, it's not that confusing if we talk about it a minute. It's just if you look at two-dimensional drawings, it might be a little confusing. So when we look at this view of the shoulder girdle, are we looking at right now anterior or posterior if we can see the coracoid process? anterior. So that's our clue, is the coracoid process. So interesting thing about this muscle is that it fills up or originates on this subscapular fossa. So looking at origin again, subscapular fossa, that's right there in the name, subscapularis. So those are easy by name. And it's kind of like opposite, maybe like mirror image, or just opposite of infraspinatus. So, you know, on the posterior side, infraspinatus is taking up a ton of the fossa. And then on the anterior side, subscapularis is taking up a lot of the fossa. But kind of what can be confusing when you're just looking at a diagram, and what's kind of interesting, I think, is that the subscapularis on this anterior surface of the scapula, then you have to imagine a torso or a body, you know, so it's sandwiched. I have the right one, yes. So it's sandwiched between the ribs and the scapula. So most of it is underneath and hidden and deep. So you can't massage the whole thing, but we can access parts of it, and that is enough to kind of help release it.